So I'm here today to talk about dementia. And the reason I'm here is because I've found a better way to do it, a way that helps both the people who have it and their families. So why should we, as citizens of America, as families, be concerned about dementia? That's something we think of being taken care of by our medical professionals. Well, there's two really good reasons. Number one, this is an epidemic. It's still growing, and we don't have a cure. So last year, 2016, 5.5 million Americans were diagnosed with Alzheimer's. And Alzheimer's represents about 60 to 80% of the dementias that we experience. So that would be about 7.8 million people diagnosed with dementia. And yet only about half of us go to a doctor and are diagnosed. So that means last year alone, 2016, over 15 million families began struggling to live with someone experiencing progressive cognitive impairment. And that's not the biggest problem that we face. Because this year, 10,000 Americans turned 60 every day. And by 2050, we will have twice as many people living over the age of 65. And that's why we talk about our silver tsunami. But if you have an aging population, then you have a shrinking workforce. Right now, we have a caregiver shortage. And in some places in the country, it's critical. But it's going to get a whole lot worse. And so the reason we as families, as citizens, should be thinking about dementia and how we can live with it and how we can work with it is because a lot of us are going to be forced to do that in the coming decade. And if you have someone in your family now or somebody that you know that is experiencing dementia, you already know this is a very expensive disease, but it's an emotionally devastating one for the family and for the person experiencing it. So why is that? You know, some people are aware that they are becoming impaired. So think about what it would feel like if you woke up tomorrow morning and you could not figure out where your socks were. And it wasn't because you were in a hotel room. You walk into the kitchen and you can't make coffee with your own coffee maker. Or you walk out of work one night and you're looking at a parking lot full of cars and you cannot think of what your car looks like. It's scary. And then you go to the doctor and your doctor says, yeah, you know, this looks like dementia. And now you know you've got 8 to 12 years of a life expectancy, and if something else doesn't kill you first, you are looking at becoming bedridden and in need of complete care. So people are terrified, and rightfully so. But then other people are not aware. They are not able to comprehend that it's their brain that is changing. And so these people don't feel as much afraid as they feel frustrated and angry, because of course it seems to them that everybody around them is being difficult, hiding things, losing things, accusing them of doing things that they did not do. And so these people begin to feel a little persecuted, maybe a little paranoid. And so they're more angry than afraid. But how do we behave when we're angry or afraid? We're not very reasonable. We're not very easy to live with. And so even before you take into account what happens to communication and interactions, when your cognitive skills are fading away, it is really stressful to try to live with somebody who has dementia. But you know, it really doesn't have to be as bad as it has been. And it's not expensive to fix this. And we don't have to all go to medical school and become doctors or nurses or even CNAs. And you don't even need a college education. But what we have to do is step back and look at dementia from a different approach. So how do we currently look at dementia? We see it as a medical problem, a disease, something that has symptoms. These symptoms are called dementia-related behaviors, and we've got a whole list of terms to talk about them with. So if I went to the doctor and my doctor said to me, you know, Judy, I really think you've got cancer, then immediately I would want a referral to a specialist, probably to a surgeon. And I would want to know everything there is to know about my cancer, how far along it is, where it is, whether it's spread, all possible treatments. And I'd want all of my doctors focused on that cancer because there's treatments. And I've got a really good chance I'm not going to have to live the rest of my life with it. So I want everyone focused on what's wrong with me, my disability, because we've got treatment. And with dementia, we do the same thing. We go straight to the doctor, as well we should, for diagnosis. But this is one of those instances where, you know, we think we've been seeing something clearly. We think we're doing the best we can. But there's no way to know that we could do it better until we actually look at it from a different angle. And so with dementia, yes, let's get diagnosis. But if we don't have a reliable treatment, one that works for everybody, one that works every time, if we don't have a cure, why are we still then turning to medical professionals focused on what's wrong, on the disabilities the person is displaying? Why don't we focus on the person? Because if you have to live with something the rest of your life, wouldn't it make more sense? Wouldn't it be more helpful if we knew what you could do rather than what you couldn't do? And if we knew how it was affecting you emotionally, this condition, that's what we need to know if we have to live with something. And actually, you know, this is an approach that's already in use. We call it being person-centered or person-directed. And when we focus on a person's condition and the person themselves, and we're paying attention to their strengths rather than what's wrong with them, we call that strength-based care. And we use it with other populations. Right now, it's very effective with adults who are developmentally disabled. But, you know, many of us here today also have been using strength-based care, some of us for quite a few decades, because strength-based care is how we raise children. So think about it. You know, when you have a child, you look at your child and you evaluate the child's cognitive development. And then you shape the environment so the child will be safe and comfortable. And then you pay attention to the child's emotional needs, and you try to meet those needs. So if you have a toddler, you institute nap time. But if you have a teenager, it's curfews. And so if you have a 4-year-old, we don't think the 4-year-old will live and be comfortable and safe in the same environment that the 14-year-old would. So we've been doing this for centuries with our children. If that's the case, how come we're failing so badly with our loved ones when they develop dementia? You know, it's because it's exactly the opposite. It's counterintuitive to everything we've been doing all our lives. Children are learning and growing and improving every day, gaining skills cognitively. But when one of our loved ones develops dementia, they are not able to learn. They're not gaining in skills, they're losing skills. And for us in America, it's really hard to not seek solution or improvement or hope. But there's a different kind of hope. And that's why I'm here today, because We can do it. We can look after people who have dementia if we know what their strengths are. So here's their strengths. And this is a picture of dementia. This is what dementia looked like to me after I'd worked for about 8 years with many people who lived alone in their own homes, even though they had dementia. So it doesn't look medical. I haven't listed the types of dementia people can get. I don't have a list there of dementia-related behaviors. What this is a set of 6 skills that every one of us can use at will with our healthy brains. And right now, while I'm talking, I'm primarily using my rational thinking skills, my memory, and mindfulness. The skills on the left-hand side. And each of you are primarily doing the same. You're using the skills on the left-hand side. And those are the 3 skills that the person who's experiencing dementia will lose. But that's not really bad news if they have a companion, family, somebody who cares, who can take care of those things for them. Because the really fun stuff is all on the right-hand side, right? Intuitive thought. Intuitive thought is how we access beauty, enjoy nature, enjoy music. It's creativity. It's also how we feel our own feelings, and it's how we interpret and receive the feelings of the people around us. And it's our experiential selves, that part of us that exists right now in the moment, receiving all kinds of sensory stimulation, information from our 5 senses. That's what keeps us connected. And mindlessness, isn't it lovely that we don't have to think ourselves consciously through every task we do every day? I can make coffee in my sleep. I do it regularly. So the person with dementia can do the same thing. They can use mindlessness skills, automatic thinking scripts, muscle memory, but only for as long as we don't move them out of their familiar location. So, examples always work best. Bob and Ann, high school sweethearts, married for 6 decades. Ann was diagnosed 5 years ago with dementia, and Bob is becoming exhausted from her dementia-related behaviors. And the other morning, they had to go downtown to a dentist appointment. So Bob sits Ann down on the couch. He kisses her on the forehead, and he says, "Darling, why don't you put your shoes and socks on, and I'll go take care of the dog." And he leaves the room. And a minute later, he comes back. And there's Ann. Ann's sitting on the couch. She has 1 foot bare, 1 shoe on, and she's trying to put a sock over the toe of the shoe. Now, Bob feels a little flash of frustration, a little bit of irritation, and a little bit of panic, because they really need to hurry. And so as he comes into the room, he says, "No, honey, no. You know how to put on shoes and socks. You've been doing it your whole life. Socks first. Socks first." And he hurries down the hall to brush his teeth. And he comes back in a few minutes later. Now Ann is sitting there holding a sock. And now he is frustrated, and now he is worried because they've got to get ready before the daughter comes. And so he reaches for the sock and he says, "Fine, I'll do it." And she reaches for him and she hits him. And when the daughter arrives a few minutes later, both parents are in tears. And Bob is trying to restrain Ann, and Ann is trying to hit him. And this is what we call combative behavior, right? It's a symptom of dementia. And so what happened? What did Bob do wrong? Why did it happen that way? Bob didn't realize it, but he asked Ann to do several things that she did not have the ability to do. She doesn't have rational thought, so she can't follow the steps in a process. And he asked her to do 2 things at once, shoes and socks. And then he gave her directions, socks first. And he asked her to use her remembering self, her memory, to recall something she'd done her whole life. And in doing that, he put her on the spot and he embarrassed her. And that never goes really well in a marital relationship. And the mindlessness tools that she probably still had at her disposal, if she'd only been given one step in the task, went right out the window when that turned into a really negative event in her life. How could Bob have done it differently if Bob knew what her disabilities were, but he knew what her strengths were? If Bob knew that Anne had fully operational intuitive thought and was picking up every one of his emotions like radar, then he could have been very careful not to display or feel his frustration. What if he dealt with the whole thing differently? Let's say Bob says, "Here, Anne, sit down on the couch," kisses her on the forehead, and says, "Here, honey, here's your favorite blue socks. I love the way they bring out the color in your beautiful blue eyes. Why don't you put your socks on and I'll go put Muffy out?" And a minute later he comes back in, and maybe she got the socks on and maybe she didn't. And he kneels down and he helps her put the socks on, and then he says, "Wonderful, darling, thanks so much. How about you put your shoes on while I go brush my teeth?" Well, this time nobody got put in the spot. Nobody's been asked to do something they cannot do. And this time Anne feels like she has a partner. She feels like she and her husband are working together like they always did. And so this time, maybe she did succeed in putting on shoes as a single task. But one thing that happened for sure is her experiential self continued to experience the present in a very comfortable way. She felt loved, she felt safe. And, it doesn't matter whether we are children or adults, whether we have a disease or we don't have a disease, and it doesn't matter whether we have dementia or not. We all have the same human emotional needs. And when somebody's experiencing progressive cognitive impairment, the skills they have at their disposal are changing. They're going to be using the 3 on the right-hand side of my table. But they still need to feel secure. And they still need to feel successful in social situations and have a sense of well-being, feel in control, able to make decisions. It doesn't go away when we get dementia. So that's why I'm here today. We can do this. We raise children. We've been doing that for decades, centuries, entire civilizations. And we can be kind to people as they get dementia because we can learn this simple little pattern of the skills they retain. So thank you. And I look forward to having many families joining in this new way of approaching dementia care.